Good morning, everybody. It is Thursday, and it is Dr. Neil, the Real Deal Psychologist, back with you to give you another short video chat. What's on my mind, what's going on. We are in my backyard again in the beautiful Arizona, and the temperatures are awesome. Here in the 60s and 70s up through the 80s. So a little weather report for you, for those of you who are outside the state. It's awesome. This is one of the reasons why people move here. So I wanted to talk to you today as a psychologist about what is therapy. You know, I thought that would be an important topic to cover. There are lots of people out there who go to therapy and seek counseling, are comfortable with it, know what to expect, or if they don't know what to expect, they want to give it a try, and it works for them. And there are some people out there that it's difficult for them, and it may not work out the way that they wanted it to. And then there's a lot of people out there. Statistics show that 1 in 5 people could be diagnosed with a mental health challenge at any time in the United States of America. Of those 20%, less than half ever seek out any kind of assistance, whether it's to go to a psychiatrist or a primary care physician for medication consults, or to a counselor, a social worker, a psychologist for therapy. So you have a small percentage of people, of even the people who admit that they need help, going out there to get help. And I think part of that reason is I listen to people talk about is that you're nervous. You're not really sure what to expect. What am I going to do? What do I get out of this? How does it work? I've seen things on TV which might be some really bad examples of therapists. And there's a lot of really bad examples of therapists on television. And is that how it works? Well, not really. Most of the time, it's not how it works. So I wanted to give you a little insight today, and then maybe in the next couple of little video chats about what is therapy and what it looks like. And remember, this is Neil's perspective on it. I have training and experience in doing therapy, but it is my perspective, and it's informed by all the training and research that I've done and things that I've learned from other people. So to begin with, good therapy to me, and again, I am a therapist who's very into what's called person-centered therapy. So it's very much focused on the client and what they need and what I can do for them. So we always start with them. Good therapy really starts with listening. A good therapist is there to listen a majority of the time. Listen to what the client has to say, clarify what their issues are. So you're working over the course of a session or maybe multiple sessions to clarify what is the challenge really, what is it that you're struggling with, then to devise some interventions, collaborate together. The therapist and the client are working together to develop what might be some interventions based on the clarification of the problem. What are some interventions, and then making a plan and then following up on that plan in the next sessions. That's kind of the basics of it. But let's talk about the nuts and bolts. When you go to a therapist the first time, most of the time, that first session usually lasts about 50 minutes. That's the good therapist hour, 50 minutes of time with the client, 10 minutes of time to do some paperwork as related to that particular person. You come, the therapist greets you, you go into their office, maybe it's you and your partner, you and your children, or your child. And that first session really is about getting and exploring what it is going on with you. So they're going to ask you several questions. They're going to try to understand your background and history, what's relevant to the case. Sometimes they'll want to know some background, like real good past information. So maybe like your childhood and growing up, that's important to the style that they use as the therapist. Or maybe sometimes they just want to know about what's going on right now. And so they're very much a here and now type of therapist. So what should you expect? Someone who's listening, asking questions that are about you, and what your issues are, that they're focused on the things that matter to you. And then you have some responsibility in being able to interact. Here's what I need. This is what I'm looking for. Maybe I'm not really sure what counseling is all about, but I came here today because of this. And I have some questions myself, and these are my questions. Or this is what I really think you should know. We didn't touch on that today. Can I tell you about this? So it's a dialogue. It's a back and forth. Asking you questions, focused, listening, clarifying, and it's very, very normal to be very nervous or even afraid of what might happen. Even myself, having gone to therapy a couple of times, and going to people as a trained therapist, I know what it is. I know why I'm there. I know how it works. And even myself, as I sit on the other side of the couch and talk to that person who's there for me, is going to keep everything I have to say very private. I mean, we're not allowed to share anything outside that session. It's still very nerve-wracking. I don't want to tell you what it is that's bothering me, because I'm worried that you might judge me. You might have negative thoughts about me, when actually that's their job. Their job there is to be kind and accepting, and to focus on you and to help you in this private environment. So therapy, it can be very nerve-wracking, but it can also be a very calm, comfortable place for you to share the things that you need to share, and talk with someone who's focused on you and listening to you and helping you devise those interventions or those plans that might help you move forward to what you need. So I'll talk some more about it, but that's kind of an intro to it. If you have questions, hit me up on social media, connect with me. Have a great day.